Hello, everyone, and you're welcome back to the channel. Today, we're going to discuss social determinants of health. We're still looking through our topics in public health. So, today, we're going to look at social determinants of health. Now, what do we mean when we hear this term social determinants of health? Social determinants of health refers to those factors that are not biological and they are not genetic, but they affect our health. So, factors that have been seen to play direct and indirect roles in the health of individuals and population in a whole that are not biological in nature and they are not genetic, yet they play this role, they affect our health, are what we refer to as social determinants of health. Now, social determinants of health are really important. They are really important because research has shown over the years that clinical care, that's medical care when you go to the hospital, accounts for only 10 to 20% of our health care. So, illnesses, being able to live a healthy life, 10 to 20% of that is going to be, medical care is going to be in charge of that. But the remaining 70 to 80% of our health is determined by different social determinants of health, different factors that these factors include environment, lifestyle, education, economic status. All these things are what we refer to as our social determinants of health. And social determinants of health, they're important because they lead to or away from health inequalities. In public health, we like to talk about health inequalities. So you have a situation where you are looking at the different kinds of health that different people in different strata of the society have access to and are having. So the kind of health, people who are poor, they have limited resources, they have limited funds, they have limited access to healthcare. All these affects their health, affects the way they live out their life. So all of these kind of inequalities are what we refer to as health inequalities. This disparity that is there between those who have access to more funds and those who have limited access to funds when it comes to their health and their lifestyle. So, based on the recommendations of the WHO, we'll look at about five different domains that discuss determinants of health. So, five different domains of the social determinants of health. Now, these domains, they range from, or we can also refer to them as categories, five different categories of social determinants of health. These categories, they range from economic stability to education and access to quality healthcare, to healthcare access and quality. Then we have neighborhood and built environment, and lastly, social and community context. So we'll take them very quickly, one by one. The first is economic stability. It's very obvious that your health is linked to your economic stability. And when you're talking about economic stability, you're talking about household income, personal income, socioeconomic class and status. So, how much money do you really have to be able to use to access healthcare? The economics is important because usually those who have more money, have access to more funds, are able to access better kind of healthcare. So this is a very important part. Food security, house instability, all these things are all part of economic stability. Those with more funds will have access to better housing, access to better environments, and this would help their health because they have better incomes, they eat better food, they can have better lifestyle. Of course, their health would be better on the general when compared to those who do not have access to these kind of things. Next, we have education access and quality. Now, the kind of education that everyone has or that the person has, affects his health in diverse ways. Those with just primary or rudimentary level of education, those with secondary or high school, and those with the university and the degree, and higher degrees. All these things, they affect one, our ability to think critically, our ability to understand concepts, and it also affects the kind of access we have, what we think we should do with our health. So those who are better educated tend to take their health more seriously. They tend to realize that there is a correlation between their lifestyle and their health. So they take their health more serious. They understand concepts in health better, and this helps. So education is really, really important. Even education also would lead to better employment opportunities. So many times people who are not well educated, it might, I'm not saying every time, but it might limit their access to employment opportunities, and this would affect, the way they live their lives, and in at the end it also will affect their health. So, and also, like I said earlier, education, helps your critical thinking, helps you to be able to think critically, understand concepts, know what we are talking about. And so education is another important social determinant of health. It is very, very important. Now, the next one is healthcare access and quality. The access to healthcare is very, very important. We've discussed this in the past. Those who have access to better healthcare, of course, will live better lives that are more healthy. If people have to travel very long distances to be able to access the right kind of medical care, it will affect their ability to, take care of them when they take care of themselves, sorry, when the need arises. So when there's need for medical care, when there's need for healthcare, access to healthcare is very important. Those who live in the rural areas, who live in the hinterlands, who might find it difficult to access, healthcare facilities, it affects their health. When they have health, they may resort to self-medication. They may resort to other things that are not very healthy. They may engage in, dangerous cultural practices, all because they have limited options. They have no alternatives for on how to take care of their health. So health access and quality is very important. It's an important social determinant of health, and it will affect how healthy or otherwise an individual will be. We also have neighborhood and built environments. Now, this talks about housing and our neighborhood where we stay. It's very important. You're staying in the right kind of neighborhood, well laid out neighborhood, well aerated, well ventilated, with good scenery, good sunlight, walkways, and when an environment is better and is well built up, those who live and work within that environment are more likely to live a healthier lifestyle. They're able to go for runs, they're able to go for walks, they have fresh air. All of these things affect our health. Contrast that with a situation where one is living in a crowded environment, living in a room that is not ventilated. You have 18 people living in a single room. That would be difficult. It would be difficult for such kind of people to be healthy, because they are prone to different kinds of illnesses, tuberculosis, all these other kind of illnesses can become their portion very, very easily. So neighborhood and built environment is also very important. The last being social and community context. This is also important. Having social groups is very, very important for our health as individuals and as a population. So belonging to social clubs, recreation clubs, belonging to churches, belonging to cultural communities, age group associations, and all these kind of things are very good, because it will help an individual to have this sense of community. And then, when life throws you down, when there are difficulties in life, you have a support group to fall back on. The family can also help, extended family, like we have in our African context. When you have extended families where people live in a largely communal lifestyle, this kind of lifestyle can help them in their health, especially their mental health. Social support is very important for mental health. So these are the categories for the social determinants of health. Now, very quickly, we want to ask ourselves that what are some of the strategies that public health could put in place to improve social determinants of health and to reduce health injustices and social injustices and health inequalities. Some of these things can include policy change. It's important for government, its agencies, its donors, and its partners to understand that policies can be put in place to help people with better access to education, better access to health care, better living condition, better houses. All these things can be worked upon with policy. With the right kind of policy, people would live a much better environment. We can also work on community-based health promotions. It's important for those professionals, bodies, agencies, to work hard at pushing out community programs that can help the health of individuals. Mass campaigns in the community, for an example, vaccination, all these different kind of things can be done to try to improve the health of the community as a whole. It is important to improve access to education, to improve job quality, and all of these things are policies which can be put in place that can help to make life better. Thank you for listening to this. I do hope that you have gained one thing or the other discussing social determinants of health. Remember to like our channel, remember to subscribe to it, share it, ask us questions, and we are here for you. Do have a wonderful day.